Great question. So in simple terms, this is where a lot of people fall over. Where do I start? When we look at treating either an individual or a group of people, we need to go through and make sure that we're treating the ones who need the help first and foremost. We do this with a system known as the 4Bs. This stands for bleeding, breathing, burns, and then breaks. Something you need to take into consideration with this though is that with regards to broken bones, you're going to be dealing with somebody who's generally in a lot of pain, and visually this is quite quite impactful and can be considered what is known as distraction injury. If somebody's sitting there with bone, poking through skin tissue, muscle tissue, etc., a lot of the time that's incredibly distracting. We've got to keep in the back of our mind, what is the mechanism? How does this happen? Is there any issues with regards to major bleeding that this fracture may have taken away from that? So slow down, take your time, whether it's an individual or a collective group of individuals dealing with mass casualty situation, then we need to apply those 4Bs. Slow down, take your time, make sure you check for massive bleeding. That comes first, and then we work our way through breathing, burns, and then finally fractures. If there's associated massive bleed with a fracture, automatically that becomes a bleed instead of a broken bone. Take your time.